Brian Mudd Show is on News Radio 610 WIOD.
Healthcare workers, we know what they've been through during this pandemic, and now they are still going through it. They're facing verbal, physical abuse from patients. Dr. Fahmi Farah, cardiologist, joining me now. Doctor, how you doing?
I'm doing great. Thank you for having me.
So is it really, really bad? I mean, I'm seeing different news stories about verbal, physical abuse from patients. I mean, kind of give us the status of healthcare workers and what they're dealing with right now.
Yes, I do believe that the abusive nature of behavior has gone up, both in the hospital setting and in the clinic setting. We've kind of seen it throughout the pandemic, but I believe now it's a little bit worse. At the beginning and throughout the pandemic, one of the things we faced was people not wanting to wear masks in the healthcare setting, like in clinic. For example, the staff endured a lot of verbal abuse in terms of frustrated patients who just didn't believe in wearing masks, and they were taking it out on the staff. Even nurses and doctors, they're now facing a lot of frustrated patients and their verbal abuse in terms of any little thing, even having a wait time of more than 5 minutes, and it can quickly turn into a rather violent event.
Hey, doctor, the timing for this couldn't be worse either. I mean, you've got so much burnout in the medical profession. You've got shortages of staff, and then you throw in on top of that behavior by patients that's worse than what we've seen, and that's like a Molotov cocktail of badness.
It is, and I will say, majority of the patients are not that way. They're still very understanding, very good, very supportive. And most of the last 2 years of the pandemic, just as patients have leaned on healthcare workers for care, healthcare workers have also leaned on their patients to receive moral support. And we've seen that even, throughout TV, people getting out to their balcony to show respect to their healthcare workers. But it's been going on for a very long time, and it has caused significant strain through various things, the getting out of the norm from their social environment, loss of jobs, a lot of stress, and people are frustrated, and sometimes they feel like it's okay to take it out on whoever, including their nurses and doctors and medical staff, which obviously is not okay.
Talking to Dr. Fahmi Farah right now, cardiologist. Doctor, the profession is taking a hit right now with so many people leaving. We've got a national nursing shortage for a variety of different reasons. As a matter of fact, when I take a look at the profession, other than policing in America, I don't know if there's another profession that's taken as hard of a hit during this pandemic for a number of different reasons with people leaving and everything else. What's it going to take to turn it around for the medical profession, to get more nurses, to get more people to want to get into the medical profession, or to get those that are in it to stay?
I think it's going to take a lot of support from everyone, particularly patients and, hospital admin. More staff are necessary, incentivizing it, giving higher pay. One of the things, as you mentioned earlier, is burnout, which is a very, there's burnout everywhere among nurses, physicians, everyone working in the hospital, especially for the last 2 years during the pandemic. Physician burnout is a real concern. It's been going on for some time. This is even outside the pandemic. Physicians work very long hours. They're accountable for more than what they should be. And the amount of paperwork they have to do outside of just having the responsibility of taking care of so many patients, the long hours, the sacrifice they have to make on a daily basis, they're just held at a different standard from everybody else at a workplace. And I think there needs to be a change and reform at all levels to really battle this problem.
Doctor, you're a cardiologist, and I know at this time of year, there are more heart attacks, more men die of heart attacks than at any other time of the year, right around Christmas. Why is that?
It's more than one factor. During this time of the year, there's a lot of stress. The holiday expense and the financial strain can cause new stress on people. Generally, food tends to be pretty unhealthy during this time of the year. That plays a role. Alcohol consumption goes up. People tend to travel and they become distracted. They get out of their regular routine of healthy eating, exercise. Sometimes they skip taking their medications and noncompliance becomes an issue. The flu plays a role too because the flu can increase the chance of having a heart attack. Cold weather, places where people have to shovel snow, that usually increases their metabolic activity from what they're used to. That stress can also cause sudden heart attack. So it's a multiple factor thing.
Yeah, I had two people close to me, about my age, drop dead from heart attacks within the last 2 weeks. What's the best advice that you give not only to males, but anybody out there as far as taking care of your heart and really this time of year, I guess, reducing that stress any way possible? Would that be the number one piece of advice?
Yes, managing risk factors. So making sure to take your medications, eating healthy. Moderation is key during this time of the year in terms of eating. Obviously you want to enjoy the holiday food, but you want to do it in moderation. Stress management, very important. Getting good night's sleep and making sure to follow the advice of your doctors. Continue to take your medications and exercise. Minimizing alcohol consumption and smoking cessation. All those would be advisable.
All right. Doctor, thank you so much for your time.
No problem. Thank you so much for having me.
That's Dr. Fahmi Farah, cardiologist.